Thermoregulation, also known as hyper and hypothermia. Very important to keep this in mind in regards to Celsius versus Fahrenheit. We have many different ways of checking a body's temperature, rectal. We can also check it orally, check it in the armpit, tympanic membrane in the ear, or skin temporal. Different ways that heat and cold move against and with each other. Conduction, heat to an ice pack. Convection, fan blowing air. Think of the convection oven settings when you're baking. Radiation, a body giving off heat, or little old school, the radiators in a house. And evaporation, the sweat drying off the skin. Now, hyperthermia is classified as a temperature above the Fahrenheit degrees of 105.8 to 100.8. And if you have a fever in that range, cell protein denaturing begins to happen, and irreversible cell death obviously is that. In a child, they will have a febrile seizure because of the high temperature. Also, they can have a febrile seizure from the dramatic change in temperature. The treatment for this, removing excess clothing, get them cool them down. Put some ice packs on their groin area, armpit area, back of the neck, where major blood vessels are passing through and can cool down easily. You can give some antipyretics, such as Tylenol, to help lower it, depending on how high that is. And you are going to get some tests done while you are being evaluated. Urine culture, blood culture, and they're going to swab for some RSV or some flu. So if all of that comes back okay, you're going to get a spinal tap. So one of the ways that we can prevent these things from continuing, stay healthy, wash your hands, cover your sneezes. Hand hygiene is key when it comes to preventing transmission of diseases. And hydrate. Drink your water. Lifespan considerations. Infants versus older adults. Infants do have more risks, so to speak. Infants have a thin epidermis, and the blood vessels are closer to the skin. And we talked about the febrile seizures already. That is a huge risk. Older adults are more sensitive to the extremes in environments. They have the lack of the brown fat in their system, so the older adults are going to be very cold, very, very, very cold. Now we're getting into hypothermia. This is a body core temperature of less than 35 degrees Celsius, which is that much Fahrenheit. This means that the heat produced is less than the heat loss, and they are too immature to shiver. They have not learned how to do that yet. They're not able to. Now, adults, not only have they lost the brown fat or the subcutaneous fat, they also have thin skin, and that's going to make a difference too, as well as they also have a difference in a core temperature versus the skin temperature. Mild, moderate, and severe. We have a mild case of hypothermia if the body temperature is between 32 and 35 degrees Celsius. You have some shivering, some lethargy, and you might be a little tacky. You're moderate. This is a core temperature of 28 degrees Celsius to 32 degrees Celsius. You have a decreased mental status. Shivering stops. Become bradycardic. You have an irregular heart rate, and you have pallor, and you're cyanotic, and possibly death. So very unwell. Severe is a body temperature of less than 28 degrees Celsius. Pupils are dilated and they're unresponsive. The individual can go into a coma or even die from having a body temperature that low. Rewarming, this can be very painful, very, very, very painful. So we always make sure give the pain meds as soon as you can, especially before starting the rewarming process. 2 different ways to rewarm an individual: active and passive. Internal, is a warmed IV solution. Passive or active is in regards to warming blankets, a bear hugger if that is ordered for the patient. It's very important to look out for cardiac events with this patient. They got a lot going on, and this is going to take a while. In regards to frostbite, you're going to have numbness, central pallor, and edema. Different types of frostbite. Second degree, got some blisters going on, kind of like a second degree burn. Third degree, you have the blisters that are red and purple, and there is tissue death. Third degree. In fourth degree, there's tissue loss, and deeper structures are affected. And at this point, you could lose that affected area: fingers, arms, toes, feet, parts of legs. Very important that the rewarming process is done rapidly. Pain meds, pain meds, pain meds. And the extremity should be rewarmed in warm water that is circulating. Has to be circulating constantly. Again, pain medication for these patients. Nerve pain is no joke. And to help with the edema from the frostbite, elevate the extremity, if hopefully you're able to, and to help control swelling. That will also help with the recirculation as well as rewarming. So that is our little bit on thermoregulation, body balancing.